Today I'm going to do a demonstration of a physical exam of the newborn, so a brand new baby that's just been born. You're always paying attention to what the baby looks like as you're doing your exam, looking at doing a quick gestational age assessment, making sure that they have good posture, having a look at their skin, noticing what their ears look like, noticing the plantar creases, their genitalia. Those are all things that you're going to pay attention to when you're doing a gestational age assessment for baby. It's really, baby's on the warmer today, but if the baby's not, it's very important that we maintain a good temperature controlled environment to minimize heat loss throughout the exam. I'm going to take off this blanket, but because we have a nice warm radiant warmer here for baby, and we can have a look at the baby. So we're looking at the baby from head to toe. So taking a look at the whole baby, making sure that their skin, their nail beds, noticing their color, the color of their hands, the color of their feet. Really normal for a baby to have acrocyanosis for the first 24 hours after birth. So if you're noticing that the baby's hands and feet are a little bit blue and cool to the touch, if their temperature, core temperature is otherwise normal, that can be normal as well. So having a look from head to toe, examination of the newborn's head. Hold the baby. Take off baby's hat. Have a look at the baby's head. Having a look, making sure that seeing if they have any molding or caput. Noticing the sutures, the fontanelles. If anything's overriding, if the anterior fontanelle is too large or too small, or anything has already been fused, making sure that it is how you would expect to see in a normal newborn head. Having a look at the baby's eyes. So we're looking at the shape, making sure that there's no puffiness, that they're equal and symmetrical in size and place on the face, and that the baby has white sclera. You may do a red reflex assessment at this point. Some midwives prefer to do it at 2 weeks in the clinic, but if you do have an ophthalmoscope, you can do a red reflex assessment at this time in the immediate newborn period. So we're going to turn the baby onto their side and check to see, look at the ears to ensure that the baby's ears are in alignment with their eyes, that they're normal size, normal shape. And then come down their face. We're going to look at their nose and their mouth. Inspect their nose and their mouth. I plug one nostril just to make sure that the baby has patent nares and they're still breathing. Plug the other one. And then inspect the mouth. So looking inside the baby's mouth, you can open the baby's mouth by applying gentle pressure on the chin, tilting the baby's head back to ensure that you can see the roof of their mouth. At this time, I typically will just do the suck reflex because you're already here. So a baby would open their mouth and you can have a feel to see if the palate is intact and provide the baby something to suck on. They should suck on your finger. At this time too, since your finger is already in there, you can test their gag reflex as well by placing your finger way back at the soft palate and observing their reaction to that. So we're looking at the baby's neck to ensure that everything is moving as normal, that the baby has good movement of their neck, palpating the clavicle to see if there was any issues with birth. Occasionally the clavicle can be fractured in the process of birth. Looking down to the baby's chest to ensure that the baby's nipples are in line, and you can palpate the nipples. Occasionally you will feel a little some round symmetrical breast buds, and that's completely normal for babies. So now I would auscultate the baby's heart, since we're at that spot, and we're going to auscultate in 4 areas. We're going to auscultate in the aortic area, pulmonic area, tricuspid area, and the mitral area. You may also want to auscultate Erb's point, and you're noting the rate of the baby's heart. So you should be noticing that the baby's heart is beating between 110 and 160 beats per minute, that it has a regular rate and rhythm. You would note any innocent murmurs that you may auscultate, and you would listen for a full minute to ensure that you get an accurate heart rate. While you're assessing the baby's heart, you can move down and assess the femoral pulses of the baby, taking their diaper off and gently palpating to ensure they have femoral pulses that are equal bilaterally and bounding. They should be bounding. So, and we'll listen to this baby's lungs. Have a listen on both sides, and we're noticing the respiratory rate, which should be between 40 and 60 respirs per minute. You should be breathing easily. You should not be observing any retractions, any grunting, any flaring of the nose. They should be fairly clear. Occasionally in the first hour or two post-delivery or post of their lives, you might notice a few little crackles, and that is normal, as long as everything else is normal. So noted the baby's respiratory rate to be 44, which is absolutely normal. So we're going to have a look at the abdomen, palpating down the abdominal area to ensure that there are no masses. Looking at the shape, ensuring that it's not distended or it's not concave. We're going to percuss the liver and the spleen. All appears to be normal. And auscultate for bowel sounds. Bowel sounds on this side sound like little gurgles, and bowel sounds on this side as well. Perfect. This is a lovely, happy little baby. So we're going to have a look at their genital tract and their genitalia. So this is a baby girl, obviously. So for baby girls, we're going to have a look and make sure that they have the labia majora and minora are normal, which it appears to be in this baby, and open their labia very gently and have a look to make sure that their vaginal introitus looks normal. At this point, you would want to be educating the parents on proper diaper care. They're usually involved in this newborn exam as well, proper hygiene care for little newborns. If the baby is a boy, has male parts, you would be assessing the penis for the glands, the urethra opening, having a look to make sure that the urethra is placed centrally on the tip of the penis, and you're looking at the testicles for rugae and ensuring that both testicles are descended bilaterally. So look at baby's legs, making sure they're equal, having to look at their little feet, making sure that they have 5 digits on each side. At this point, you can do your reflexes on the bottom of the baby's foot. So you can do your Babinski reflex and the plantar on both sides. And this baby seems to be lovely and healthy and have great reflexes. Before I turn this baby over, I do their grasp reflex, just because they're on their back. Encourage them. They would grasp your hands, and they have a pretty good grasp. And you can kind of just gently provide pressure, and they will hold on to you. Turn the baby over. We'll have a good look at the baby's spine. I'm going to just put this baby down so we can look, but typically I would hold the baby like this. Have a look at the baby's spine, making sure that the spine is straight, that everything is intact from top all the way to bottom. Sometimes you might notice a little bit of a dimple in the sacrum. If you do notice that, to make sure that you pull apart the area and ensure that it is closed, that you can see skin at the very bottom. You want to note any tufts of hair, any areas that the skin isn't covering. And this baby looks perfect. Let's turn you back over, little one. We'll assess their hips. So this baby has good hip movement. So you're going to hold the baby's hip with your fingers around the back and your thumb around their knee, and just gently lift Barlow's maneuver to see if there's any dislocation of the hip. And then ortolani, we're going to move the babies to the side. It's difficult to do with this baby. I don't want to take their legs right off, but this is the motion that you would use. And observing with your hands if there's any clicks, if there's any pops, or if the hips are dislocating at all. So we're going to observe the limbs. We have been already observing the limbs for symmetry and movement, making sure that the baby looks symmetrical and that they're moving well on both sides of their body. Noting any webbing, any creases on their palms. And the last thing you want to do, or you can do really in any order, but make sure that you've assessed all their neural reflexes. So we've done the suck, we've done the gag, we've done the grasp, we've done the Babinski and the plantar, and then the last one would be the Moro reflex, where the baby's startle reflex, it's known as. So you gently lift the baby off the bed. I always tell them, hey buddy, I'm going to drop you, but I'll catch you, okay? And then you just let them fall into your other hand, and what you should see is a nice even Moro reflex. Their hands should come up and startle. So we've done a heart rate, we've done a respiratory rate. At this point, we would want to do a temperature assessment as well. So we would get our thermometer and do an axillary temperature under the baby's arm. Ensure that they are between 36.5 and 37.5 for temperature. If they're low, we'd want to put on some blankets, increase the heat source, and reassess in 20 minutes. If they're a little bit high, we would reduce the heat source, take off some blankets or clothing, and reassess in 20 minutes, and we should see a change. At this point, you would want to weigh the baby. So we can weigh the baby either on the warmer or with a scale, and do a head circumference measurement. Measuring their head circumference. So the baby's measurement is 30 centimeters, and then we would do their length. Stretch their foot all the way out to the end and do length assessment. And the parents love that part, so make sure that you write that stuff down for them. The weight, head circumference, and length of their baby. And then you can put a diaper on this little one and do some education about normal newborn behavior in the first 24 hours, as well as normal newborn output and feeding patterns. And then our newborn assessment is complete.